Hello, my name is Travis Bayless. I'm here to introduce Sarah. Today we're going to discuss another Let's Talk About It session. Anyways, let's get to it. So I just want to say before I begin is that I don't want to sound like I am probing you or trying to get like investigation on you. I just want to sound like that we're casual and you can pretty much say whatever you're comfortable with. So as I stated in the video before, I'm bipolar. I've been that since 2012. And I know there's a ton of adoptees with mental health issues. And there's a lot of people that don't reach out and get help. I'm just curious if you're one of those adoptees that struggle with mental health issues.
Yes.
Have you seen a psychiatrist or a therapist regarding these issues?
Yes.
Do you have any, let's say, label that they decided to diagnose you with?
Yes. Reactive attachment disorder and bipolar 2. I don't remember exactly what bipolar 2 is.
Bipolar 2 is just hypomania and mania. Bipolar 1 is like high mania, low depression.
And then
Are you officially diagnosed with all three or no?
with reactive attachment disorder.
Reactive attachment, bipolar 2, and anxiety. Are you officially diagnosed?
Anxiety for sure. And yeah, they've always labeled me with bipolar disorder.
Have you ever tried medications?
I don't like the medications.
Yeah, I've been on quite a few.
Zoloft and
Yeah.
Paxil.
So she was on antidepressants, antipsychotics, and probably, have you ever tried Ativan and anxiety or
I don't remember.
Xanax or?
I don't think so.
Okay. Can you describe on why you feel that meds were giving you a lot of problems?
I just feel like I don't want to be controlled by medicine for the rest of my life because then they'll have to increase your dose, decrease your dose, and then I don't know how that affects your mind, your body. You know, I don't know. And then it becomes expensive and then time consuming, having to go to the doctor all the time. You know, it just doesn't seem like something I want to do for the rest of my life.
Now, regarding that, did you have mental health issues growing up or did it just happen recently?
I think I've always had mental health issues since I was adopted or before that, just being a baby, because after 5 months, you have to be attached to somebody between like 3 months old, right?
Mm.
And if I was adopted only by 5 months, then I had to rely on myself. So I'm pretty independent. So by the age 15, we had to go to family therapy when my parents got divorced. And then I started having my individual therapy too. So with anger issues and depression and suicidal tendencies, stuff like that.
So that brings me to another question. You actually mentioned that you have reactive attachment disorder. I recognize that because there's another adoptee that mentioned that she had it too. Can you describe what that is in your own words?
Just not being able to connect with people properly, keep relationships, trust anybody. It's very, very hard to trust anybody.
Mm.
No.
You mentioned that because actually we interviewed someone else, Rebecca Erickson, which you know, and she stated that she's a therapist, and she stated that her topic that she discussed a lot about is attachment. And I feel that since adoptees, a lot of them do have mental illness, it's related to how they're brought up when they were really little, like babies. If whether or not their parents were there for them when they needed it, take care of them when they're crying, or feed them, pamper them, things like that. So it's very possible that people who have mental health issues, like in the adoptee community, they struggle with that because the lack thereof attachment when they were younger. Do you believe that that's possible with you too? So do you feel that back in the day when you were seeing a therapist and trying these meds, do you feel that they did enough to at least keep you somewhat stable, or at least in a better condition than?
I don't know. I just got more depressed when I was like 18 or whatever, you know, trying to cut myself. And I took an entire bottle of Aleve. So my dad had the fire department break the door down, and I had to go to the mental hospital for 2 weeks in high school.
Now, do you feel that the hospital helped at all, or?
No. it was more of a fun experience doing arts and crafts and shooting pool at the pool table with the other patients, I don't think there was much therapy going on. You have to find your own therapy, really, because I don't think any doctor will ever know you enough to know what you need. You kind of just have to find it yourself.
Now, as an adult, do you feel that, since you stated that you don't see therapists currently, do you feel that do you think things are better for you now, or since you were in the beginning of your mental health issues?
That make me happy.
So another question that I have is related to just in general the resources that you have. Do you feel that as of right now, if you needed mental health resources, are you able to access them in New Mexico?
I just probably wouldn't go to any professionals because I don't know if there's anyone there to really actually honestly help, because that's why I have my family and friends are more important than any therapist, because they'll give you an honest opinion, and they're better support than anybody because you can trust them.
So that brings me to another thing I want to address. Do you feel that your mental health issues is somewhat genetic, even though you don't know your parents?
Yes. My birth father was diagnosed with depression. That's all I know.
Do you feel the adoption itself is related to how your upbringing was in terms of your mental illness?
Yes, feeling different, not looking like my parents, just feeling out of place and alone.
Do you feel you had identity issues when it came to growing up?
Because I'm like, I don't know where I fit in. I feel like I don't belong anywhere.
What are things or activities that you do to help relieve yourself from having a depression or anxiety, things like that? What are things that you do to help cope?
Comfort foods, like chocolates, like that, or just my hobbies, like arts and crafts, social media, talking with people,
Okay, so Kyle says that you've been labeled crazy. Do you feel that has affected you emotionally, negatively?
It makes me angry, yeah. Like, I think everybody's crazy in their own way, so I really shouldn't get angry about it. It's just their, I guess, blunt way of their perception of me, because I do things that a lot of other people wouldn't say or do,
What is your opinion on people that also experience mental health issues? Do you think they should take your advice as well, or do you feel it's up to the individual?
Different. My sister thinks she needs meds, so I'm going to try to talk her out of it, but that's not my business. So, if meds work for other people, therapy works for other people, but I don't trust people or meds. So.
Okay, so what kind of interests me is you're willing to mention that you do have mental health issues. Do you feel that you want other people to know about it or to understand you, or do you just feel some other reason on why you feel you want to just come forward with some information regarding it?
No, it's just, I guess, part of who I am. That's it. It doesn't really affect me too much unless I really think about it, and I'll get really depressed or something. But
have you connected with other adoptees that might experience the same mental health issues that you've had?
I'm not sure, because I haven't really met too many people that would actually openly talk about their mental health issues. I just know the people around me that have their own personal issues that they're dealing with, alcoholism or something, depression, and all that. When
it comes to your own mental health, do you usually keep things to yourself, or do you let someone know that's close by? Or
it depends, how I'm feeling, or if there's anybody available to speak to.
Okay. Now, this is the reason why we're doing this, is that we're just trying to get people to talk more about their mental health issues. So that's the whole reason. In which you did. And I don't want to someone probing all the information out of you. I just want to get your opinion. Do you feel other adoptees need to speak more about their mental health issues?
If they're feeling suicidal, yes, definitely. It's something I think about, but there's so much stuff I want to do and things I want to see.
Do you know if there's a lot of Korean adoptees that you know that might also struggle with mental health issues, and have they addressed that to you?
Just growing up with my brother and sister, I know that they have mental health issues.
okay.
Separate adoption, but it's my brother's an alcoholic. He's a very angry person. So, and I haven't heard from him in months. My sister, she's got her issues too. But growing up, we are all having anger issues. But I think she cries. But I hardly ever cry. That's another thing. I feel broken.
Was there a stigma with mental health issues regarding your family, or did they not know about what was going on?
I think they would have had to, because I was hospitalized for 2 weeks in high school. And then, my relationships, they know. They always like to call me psycho or tell me I'm bipolar all the time.
Did your parents support your mental health journey, or were they against it, or?
I don't know. Maybe my dad wanted to avoid it. And then my mom, when she was around, maybe, I don't know, she may have helped. I mean, she took me to therapy in high school and stuff, but I don't know if any of that really helped.
So you feel the thing that helps the most is your kids, possibly, or maybe your job or activities you do?
Responsibilities. I know I have things that I have to take care of, which are my kids, and I have animals I have to take care of, I feel like they need me.
Do you have any advice for people that, like KADs, that feel that taking the life is the only option? Is there
They
anything?
can talk to somebody. Always have somebody to talk to.
What do you think is the next step if they end up talking to someone? Do you feel it's hospital? Do you feel like they need to keep talking to that person? Do you feel that they need some other type of issue? What do you feel that would be best option?
I just always needed someone to talk to. So definitely have someone to talk to. And if you're really thinking about it a lot and you really want to hurt yourself, you need to put yourself in the hospital.
So there are some negativities when it comes to having mental health issues, but there's resilience with it. Do you feel that you've had the ability to at least manage your life better than what you were when you were younger?
Yes, because I'm an adult now. So yes.
Do you feel that there is any attributes related to you being a KAD that you think was positive?
I just think about I could have had a worse life, if I weren't adopted. So I guess kind of maybe I was slightly privileged being alive still.
What do you like about yourself?
It's very hard with low self-esteem. But I guess I'm good at meeting people.
So you like being social and getting to know people?
Yes.
Okay, that's really good. All right, that's it. Thank you.
Thank you.